In the meantime, the Nigerian Union of Allied Health Professionals is requesting for a cessation of all forms of discriminatory and unfair practices against other healthcare professionals in the sector. This request formed the basis of the Health Sector Reform Day with the theme Eliminating Professional Dichotomy and Discriminatory Practices in the Health Sector. TVC's health correspondent Kemi Balogun reports.
About 1.4 million visually impaired children across the world, with 75% of them residing in Africa and Asia. The advocates from the Center for the Blind are improving lives of persons with visual impairment by contributing to the achievement of the Sustainable Development Goals.
The more people we take out of poverty, the better, employment, and we reduce poverty, so by educating them, by giving them the opportunities, they'll be able to thrive. And
For decades, there has been a crisis of discrimination between healthcare professionals, which is majorly responsible for many instances of industrial disharmony and interprofessional rivalry within the sector. This burning issue tops discussions at the commemoration of the Health Sector Reform Day. Speakers are now seeking government intervention towards ensuring that discrimination on representation, promotions, appointments, and even training in the health sector comes to an end in compliance with international and national laws.
The entire public health system is manipulated to have only members of a favored profession to dominate all others on a permanent basis, notwithstanding the multidisciplinary nature of the health sector.
I'm just surprised that we still have some other sectors where there are dichotomy. And I think it is very, very necessary for Ministry of Labour, in conjunction with Ministry of Health, to ensure that an immediate action is taken on this to remove those dichotomy.
The Cuban ambassador to Nigeria also adds her voice, highlighting some tips from her country that Nigeria's health sector can also adopt.
We believe that in a public sector, you win the struggle for health of the people at the bottom level. The network of doctors and nurses and health workers in general throughout the country in order to put medicine and health at the service of the people.
This pressure group wants to simply correct what they believe are the ills in the health sector through a list of demands.
The outright stoppage of all forms of discriminatory and unfair practices against other health professionals. 2, the appointment of Chief Medical Director and MDs should be thrown open for other healthcare professionals to compete and should be redesignated as Chief Executive Officer.
The calls for more collaborative effort remains loud at this gathering as part of ways of reforming the health sector to ensure that Nigerians get the best out of a properly functional healthcare system. Kemi Balogun, TVC News, Abuja.